Over 400,000 Americans have lost their lives to opioids since the year 2000, and many more lives have been ruined by addiction. Purdue Pharma, the corporation that created OxyContin, is generally blamed for the crisis due to their efforts to reorient the medical community and change the narrative regarding the dangers of addiction. Let's go over a specific example of how they went about doing this. In 2004, the New York Times ran an article containing this wildly misleading statement regarding the danger of addiction.
Contrary to media portrayals, the typical OxyContin addict does not start out as a pain patient who fell unwittingly into a drug habit.
The author of that article is Sally Satel, a fellow at the American Enterprise Institute specializing in medical issues. Coincidentally, the American Enterprise Institute received $50,000 a year from Purdue Pharma since 2003, plus an additional $800,000 for special events, according to documents received by ProPublica. But it gets better. What study did Satel cite in order to defend a funder of her institute?
The National Household Survey on Drug Abuse found that among non-medical OxyContin users, 98% has also used other addictive pain relievers for non-medical purposes, and more than a fourth had used heroin.
Well, what they don't mention is that that study was actually carried out by employees and consultants of Purdue Pharma. Now, Sally Satel says she has no idea that her institute was funded by Purdue. The New York Times and the American Enterprise Institute have denied any wrongdoing. But Sally Satel didn't just defend the profits of Purdue in the New York Times. She also did it elsewhere. She was quite a media star when it came to pro-painkiller opining.
OxyContin does not cause addiction. Its abusers are already addicts. The real public health damage here comes from the pitched campaign conducted by zealous prosecutors and public interest advocates to demonize the drug itself. This is tragic because OxyContin has been a godsend for millions of patients. Only a minority of people who are prescribed opioids for pain become addicted to them, and those who do become addicted and who die from painkiller overdoses tend to obtain these medications from sources other than their own physicians.
But media spin was just one step. Purdue also funded other organizations to push its agenda of more prescriptions for painkillers. The American Academy of Pain Medicine and the American Pain Society promoted this, for example.
Studies indicate that the de novo development of addiction when opioids are used for the relief of pain is low. Furthermore, experience has shown that known addicts can benefit from the carefully supervised, judicious use of opioids for the treatment of pain.
Purdue admits these donations were made, but it defends its position.
Purdue has been contacted over the years by policy experts at a variety of think tanks who are seeking additional context on industry issues for their work. Our engagement has always been appropriate and aimed at providing a science-based perspective that the company felt was often overlooked in the larger policy conversation.